Hi, I'm Dr. Andrew Cohen with Proactive Chiropractic, and hopefully you're enjoying my handlebar mustache. No, it's not a mustache. It is actually called a Graston instrument. And Graston is something we use really frequently in our office. And what it does is it helps reduce restrictions in the body. So we are going to slide along the muscle and fascia and figure out if there are any adhesions or areas where the muscles aren't sliding as well as they should. And we will help kind of break that down. If you want to think about it in your day-to-day life, I like to compare it to raking. Essentially, there are different fibers that are all different directions, and we're going to then rake them so that they are parallel to each other, which allows for better flexibility and better muscle strength and contraction. So what happens is, after an injury, our body tries to heal as quickly as it possibly can. It starts laying down muscle. Actually, these little things called fibroblasts come in there and they start healing it up as quickly as they can. The downside of that is the fibers are kind of wonky. They're not tidy. And so after that, once it's healed, and even along the process of healing, if we can get in there and sort of rake out the fibers so that there is more consistency and I guess a better pattern along the muscle fibers, then it allows for more strength and more flexibility again. So Graston is an amazing tool for that. But we also are looking at the fascia in many other ways at Proactive Chiropractic. And one of the tools that I found in the last year that's been a game changer for us, which really kind of took our Graston approach to the next level, is a technique called Fascial Distortion Model. And what that is it's basically looking at how all the different tissues along the muscle groups, but not only the muscles, but the fascia. So fascia is a fancy word. It feels kind of weird to say, but it's the lining around the muscles that basically hold things in place and kind of anchor them down, and also allow them to slide against each other without creating a lot of friction or a lot of damage to each other. If you think about a chicken breast has this sort of white substance around it, sometimes stringy, and usually before we cook a chicken breast, we peel that off because it kind of doesn't look good. But the white stuff is really the fascia. It was holding this chicken breast in the right place. But if you also think about that chicken breast, if you drop it on your counter, if you have a stone countertop, and you push it, it'll slide. It'll slide really easily, actually. If you sit it outside for a little while and it starts to get dehydrated a little bit, it then becomes sticky. And so the fascia just sort of like holds in the moisture, holds everything where it needs to be, and allows us to move more efficiently. And so FDM, as it's called, or Fascial Distortion Model, allows us to figure out exactly how the fascia is being limited. Is it a trigger point in one specific spot? Is it a trigger band where a whole area of an extremity, typically, or an arm or a leg, has this like track of pain? And we can use that to really get in there and fix this situation. So the way that the patient describes the problem gives us some amazing insight into the way the fascia is distorted, which is why they call it the fascial distortion model. There's also a herniated trigger point, which is some of the fascia gets sort of like caught up in itself or in another area of fascia, and it's kind of pinching on itself, which restricts movement and causes a lot of pain. And that's something that we're able to help with. And then the fascia can also get sort of like wrinkled up. If you think of a shirt, it can kind of get twisted and you'll see all the wrinkles in it. And we need to like unwrinkle it so that the fascia can move as well as it should. It's an abstract concept at first, and honestly, I've been hearing about it for a few years, working at the Olympic Training Center, working with high-level athletes. Many athletes were telling me how they were getting great response with fascial work, and I felt like we were getting awesome results already with some of the Graston work and ART and different techniques that we were using some of the tape. But adding in the fascial distortion model really helped kind of fix some of those tricky cases that weren't responding to our other tools that we were using in our toolkit, as far as trying to get you feeling better. So if you have something that's tricky, and you've tried the normal stuff, icing, resting, stretching, but the pain remains, you've seen some providers, and they weren't able to get to the bottom of it, do not give up. And I want to repeat that. Do not give up. You just need to have someone look at it from a different lens. And that is what the fascial distortion model allowed us to do at Proactive Chiropractic. Obviously, for those of you who are nearby, we'd love to help you out. I'd recommend you schedule a consult. We'll chat with you for free and figure out if it's a good fit. But if you live in another area, I would encourage you to go to the Fascial Distortion Model website and find a provider near you. It's a whole nother lens that I am seeing incredible results with, and I think that you'll also see some great responses as well. So thanks so much for watching. Happy to help if there's anything I can do. If you have any questions, feel free to write something in the comment section and subscribe. Thanks so much. Have a great day.